I'm Mary Pipino, and welcome to Fit for You, the show that teaches you how to live a healthier and more fit lifestyle. Welcome to 2013. I love the month of January because everyone is so motivated to get healthy and to get fit. But I took a little different twist on today's show. Everybody's talking about diet and exercise. We're going to talk about plastic surgery and cosmetic procedures that oftentimes can get you really motivated to get healthy and fit. I'm going to be joined by my friend and one of our finest plastic surgeons in the country, Dr. Brock Generalovich. I hope you enjoy the show, and welcome to 2013. We're approaching January 2013 a little bit differently than everybody else who's talking about health and fitness. We're approaching it with my friend and one of the finest plastic surgeons, Dr. Brock Generalovich. Dr. Generalovich is dual board certified in plastic, reconstructive, and cosmetic surgery. He trained at the University of Pittsburgh at the Cleveland Clinic, and he's from our local area, Hermitage, PA.
Yes.
Welcome, Dr. Generalovich.
Thank you.
I thought it would be interesting today to take a little different approach to health and fitness and talk about how some of the things you do can jumpstart somebody into it, and why health and fitness is important before and after some of the procedures you can perform to get someone to be looking their best.
Sounds good.
Should we start with the face?
Sure.
And fillers, I'm assuming, is the first step when you think about doing something cosmetically.
You're right. Fillers are one of the more common things that we use for folks. We use that in combination with Botox or medications of the like. Botox is used to stop a lot of the small little wrinkles of the face in this area, in the forehead, the crow's feet, and sometimes around the mouth.
Oh, you can use Botox around the mouth?
You can in very small doses. We don't use it that often. It has to be the exact right kind of situation. Some doctors place it there because it's not going to cause an enormous difference. For me, it has to be the right patient, because otherwise it's a waste of your time and a waste of your money. So we try not to waste your resources for something that's not going to give you that much of a change. More what we use around the mouth and the face and the lips are the fillers, like you said, and they can be enormously beneficial in making small changes for folks that they really like.
All right, so let's talk about, because we'll get the little crevices here, naturally get the lines in the forehead, the little crow's feet around the eyes.
Yeah.
So I come to you, and what do we do? Do you numb it? How do we go about getting this?
The first thing I do is I listen, and what I do is I try to customize whatever treatment we're going to have to each patient. We try to ask the right questions and find out what people are most sensitive to. So when a patient presents, they usually have something in mind that they want to make a change to, is some part of their face. But the key, and really what helps us, is the sort of the synergistic use of all the different things that we have to help. Sometimes it's surgical, sometimes it's a filler, sometimes it's a Botox treatment. And what we do is we listen to what the patient is, and it's not, a lot of times I say what the lady is, but a lot of men are starting to open up to realize that these are very easy things to do. They're very well hidden. People don't know that you're making these changes, but it really makes them feel good about themselves, and it gives them a lot of confidence. And what we do is we listen to them to find out where they're most sensitive. If there's people will come in, and it'll surprise me, at least once a week someone comes in and surprises me as to what they're most sensitive to. So if this bothers you, or if the crow's feet bother you, sometimes the deep lines, the nasolabial creases here, the marionette lines that start to develop here, or sometimes some of the changes that occur to the lips, little things like that. And everybody wants a different plan, so we customize it to the patient, and then we move forward. And it can include a whole bunch of different modalities.
You know, you're bringing a very interesting point when you bring men into the equation. And a few years ago, especially in bigger cities. You know,
Mhm.
it was very popular for men to start to participate in these things, and I think it's just starting to penetrate very quietly into our area.
Yes.
But, you know, it's nice to know that men can confidentially call your office, come in, and have some of these same procedures that can make a
Sure.
very big difference in their professional lives.
Oh yeah, and what we're seeing is more and more. It's not as much of a there's not as much of a stigma surrounding it. And you're right. There's very big campaigns in some of our metropolitan areas to push men to start taking better care of themselves. And what happens is a lot of times in the workplace, a man or a woman, their confidence very much affects their productivity or their success. And we see now more often. I think one of the things is that as a former athlete and not necessarily a smaller man, more of the guys feel comfortable talking with me about some of their sensitivities, and that's a hard thing because you know you close the door and you let the guy say, hey, I don't like these, because men feel that too. It's not just, and the ladies are real open about it. When the men come in, we have tremendous success because sometimes in some ways it's a little easier to treat the men. Their skin's different. Their skin's thicker. The changes are very subtle but very effective.
And you know, I find people that sometimes take that step to start to look better, you know, in their facial area, then start to think, well, maybe I'll start working on my body a little bit, and then they'll get a little more motivated to do diet and exercise. And we're going to get into what you can do surgically with the body in a few minutes, but when we come in for the procedure, tell us about the recovery time. What's involved? Can we go to work the next day? What happens?
A lot of people go back to work, so it's just minutes. There's really no recovery time. Once in a while, with some of the injectable medications, you can get a little bruising, but it's very rare. If people are on medications that cause bleeding or bruising, then we have to talk about that. But most of the time, it's pretty instantaneous. We don't typically numb the face when we do this because the needles that we use for most of the treatments are so small, they're not painful. And what happens is that you come in and you can sit down and have a consultation and actually go forward with a treatment in the same day, and that's really nice because it's instantaneous. And some folks like to hear about it and they're like, okay, I want to get this done. So it's really nice in that way. There's no downtime.
One of the most important aspects for me, I think, is to have this type of thing done by a board-certified plastic surgeon or a board-certified doctor. Can you touch upon a little bit why it's so important? Because there have been some real serious issues with people. They might do it a little bit cheaper, but I don't think that's where you want to cut costs.
Yeah, one of the things that happens is that physicians that are well trained to do these types of things are out there, and some dentists that are well trained to do this are out there. And because of the fact that this is like any business, there's competition amongst providers. One of the things that happens is that folks are driven to save money and go to places that they might not otherwise think that they would go. I don't get out there and yell and scream about that too much. We provide a wonderful product in our office, and I did go through all the steps to become board certified in multiple different areas of my practice. But the big thing is that if someone can do the procedure and they're certified to do this, whether they're a dermatologist or a plastic surgeon or a family physician or a dentist, if they're doing it and they're doing it in a safe way, I think that that's okay. One of the nice things about my training is that we get a little extra training in how to give people what they're looking for and not necessarily spend as much money doing that. I think that it is important to look for board certifications. I think that that's something that is given by peers in the same field. But I think that unfortunately, because of the fact that this is a popular thing to do, folks do this that aren't even physicians, and it's a little scary. We had an incident even locally here where I had to take care of a whole group of folks that were being treated by a lay person in the community that was getting these products from South America. and they had some really dire complications, and we've had to actually do surgery to fix some of these things. So little things like that, I would expect most people would be aware. But I think that as long as the doctors that are providing this are capable and able to do this, then you shouldn't be afraid to use the products.
Exactly. Very, very comfortable coming to someone like you. Very hesitant to do anything less than that, in my opinion.
Well,
just my opinion, but let's talk a little bit about surgery. At what point, and I know you can combine them, as you said earlier, but how far can you go with the fillers and the injections? When do we need to think about surgery? For example, if we have wrinkles, or you get the little lines around your mouth, at what point do we have to say, no, we can't do, anymore with the fillers. Now we got to go to the next step.
That's pretty specialized and very much customized to each one of the patients. A lot of times it depends on what they're looking for. A lot of women come in to see me and they say, I don't want to look like, and they fill in the blank with one of our Hollywood stars that's maybe overdone it a little bit. And one of the things that I don't like to do is to give the platypus duck look with the injections in the lips. There's ways around doing those things. Sometimes when you find out, you listen to what the patient's expectations are, you know that you can't do that without making surgical changes. And what we do in the initial meeting with each one of the patients is we say, where are we going here? Because this might sound funny, because I earn a living doing this stuff, that I will tell people, don't spend your money. If you're going to do this, wait and do the surgical procedure. Don't spend your money now doing fillers or Botox and things like that. If it's just going to get you, it's going to temporize things until you do a surgical procedure that may permanently fix what you're trying to do now. And a lot of doctors don't approach it that way. And I know in my training, I saw a lot of physicians, they said, well, if people are there and they want to spend their money with you to do certain things, do that for them. And I said, well, I listened to them and I said, are you going to do this? We're going to do this, but we want to get through the holidays, and I want to do this in the spring. Or I want to do this in the fall after we've got a big summer, so-and-so is getting married, this is happening, we're traveling to do this, but I am definitely going to do a facelift. Then don't spend your money now on doing little fillers and things that are going to be corrected with the surgical procedure. I think it's really important to listen to each patient and listen to what their overall plan is, because a lot of people are not facelift people, and if they said no, I wouldn't want to have that surgical procedure, even though facelifts are not painful, they're very, very quick in recovery, and they're very, very effective in making a big difference in someone's appearance. Some people just are not going to go through that, or they just don't even think that they'd ever try that. Those are the folks that we say, okay, now let's make a plan for you and customize it to what your needs are and what you want. And then I always look at it like I'm working for the patient, so I'm going to give them what they want. I'll do for them. I'll set out a treatment plan for them. You talk to them about that, what the cost would be involved, and whether or not it would be something that they want to get.
Okay, so it's January and everybody's ready to get on a diet, eat healthy, cut out the bad stuff. We're going to teach you how to make one of your favorite foods low calorie, healthy, and delicious. We found a way to make a pizza crust with cauliflower, egg whites, and mozzarella cheese. Mozzarella cheese is a low-fat choice because it's made with partially skimmed milk. Today we created our pizza crust and topped it with fresh tomato, buffalo mozzarella, and basil. It's fantastic. When you think about making your pizza crust, combine those ingredients in the bowl. You're going to bake at 400 degrees for about 15 to 20 minutes. And you can top your crust with a variety of favorites that you love. Try to avoid the bad stuff though. Stay away from the pepperoni, stay away from the really high-fat cheeses. Get a low-fat cheese, cut up a variety of vegetables. It's great to do mushrooms and spinach and broccoli and cauliflower. Like I said, play with it and have a lot of fun. But you're going to find that the kids really enjoy it too.